Well, good evening once again. This was day 150 of the Biden administration. Today, the White House issued a new warning to Americans as this COVID-19 Delta variant now takes hold across the globe and is starting to arrive here at home. Federal vaccination effort has been going full speed. 300 million shots have been administered in 150 days. Make no mistake, that is nothing short of a remarkable public health achievement. But over the past several weeks, there has been a steady decline in demand for the vaccine. Now the nation may fall short of Biden's goal of at least one shot for 70% of adults by the 4th of July. Tonight, about 65% of Americans have received one dose, about 55% fully vaccinated. This afternoon, President Biden noted the danger posed by this new variant, and he urged Americans to get that shot.
The new variant will leave unvaccinated people even more vulnerable than they were a month ago. This is a serious concern, especially because of what experts are calling the Delta variant. It's a variant that is more easily transmissible, potentially deadlier, and particularly dangerous for young people.
Could the Delta variant force us back into lockdown?
I don't think so, because so many people have already been vaccinated.
World Health Organization says this Delta variant is becoming the dominant COVID strain across our world. CDC says it will likely become the dominant strain here within a few months. Experts are particularly worried about what it could mean come fall, what it could mean in parts of the South where vaccination rates have lagged way behind the rest of our country.
We're going to see regional surges in places like the southeast of the United States. Low vaccine uptake rates. Once we hit the fall, we're going to get cold, dry air. That's what COVID likes. It's really combating this conception that back in 2020, young people thought, well, it's my parents that are going to end up in intensive care. Now we're seeing that this is a very different risk-benefit calculation when it comes to taking a risk with a virus versus getting the shot.
And Shannon, I'd like to begin with you. As a great man once said, some days it's like one step up and two steps back. On the pandemic front, just when we have a good stretch, along comes a reminder that there's still work to do. What's the real level of concern at the institution you cover on this Delta variant?
Well, I think the concern is trying to figure out a way to get to the people who still haven't gotten vaccinated. Obviously, administration officials knew there was this low-hanging fruit at the very beginning, the people who were super eager to get vaccinated lining up right away. Then there was a second tier they were talking about people who, they weren't necessarily opposed to the vaccine, but they just hadn't gotten around to it. They didn't have time. They just needed that little nudge. And that's where you saw things like the, Ohio lottery program, or you saw, the administration encouraging employers to give people paid time off and free beer and these little incentives to nudge people. Well, there's been about a month of people getting nudged. And you still see a lot of groups, demographics, even entire states where those people the vaccination rates are still really low. They're stuck around 50% in a number of states in the South. While you have people over 40 with about 74% having gotten their first shot, you've got people 18 to 24 in some places where it's just a quarter of that age group have gotten the shot. The administration has kind of deployed all or almost all of the tools in their tool bag to try and drive people out, and they're still hitting against this wall. And what you are hearing from the president today in that clip you played earlier is sort of the next level of this in trying to drive home the fact that there is a new variant out there that is particularly harmful to young people, and that this is no longer just a question about trying to get young people out there to get vaccinated so they don't infect their grandparents or they don't infect someone immunocompromised who can't get the vaccine. It's now trying to get the message out there that this is something that could pose a real serious health risk to young people, which is certainly what the data shows us and what we're seeing in a number of countries. I think that's where you're starting to see things shift now. And the administration is clearly warning that in places where vaccination rates are low, like the South, age groups where it's low, like 18 to 24-year-olds, that's where we're going to see this virus continuing to find people and spread.